Hello, everyone. Good morning once again. I want to thank you all for making it this morning and joining this webinar. I first of all want to wish you all a happy new year. We thank God for life. We all made it to the new year, and for that we are grateful. And I want to sincerely apologize for the delay in starting the webinar. We were waiting for a number to form a quorum, and I think we just had that, so we would zoom right into the purpose for today. So we're having a webinar on technical, legal, and regulatory frameworks on digitalization in the health sector. And we have some important people in our midst that I would want all of us to acknowledge and pay attention to. So we have the Director General of NITA, Mr. Richard Ofosu, in our midst. And we have Mr. Musa Issa, the Regulations and Compliance Deputy Director of NITA. And we have our very own Mr. Sam Kwashi. And these three are going to be handling the webinar for today. But to start, we would want to invite the Director General of NITA, Mr. Richard Ofosu, to give us the Mr. Richard Ofosu, sorry, please pardon me for that, to give us the opening remarks. So, sir, the platform is yours.
Good morning. Raman, can you hear me?
Yes, please, we can hear you.
That's great. Good morning, fellow IT professionals and e-health experts. Let me take this opportunity on behalf of NITA and our parent ministry, the Ministry of Communications and Digitalization, to wish you a happy and prosperous new year. Just as Raman said, we are all lucky to be alive with COVID and Omicron and all that. So we thank God for that. I'm elated and very optimistic that this year would be a historic and different with GOG's digitalization's agenda. Why do I say that? Because NITA, under my leadership, has embarked on reforms to enable it effectively perform its full regulatory functions under the NITA Act 771 and the Electronic Transaction Act 2008, Act 772. I think most of you or some of you know, NITA was initially established by our Act to regulate, but the operations side of it got the better of us, and we've been told to focus on our mandate as enshrined in Act 771 and Act 772. The year 2022, I believe, would witness an accelerated collaborations with MDAs, as well as enforcement of the legal and regulatory frameworks impacting on digitalization in all sectors. This webinar, indeed, is one of such collaborations. The health sector is among the top 5 largest sectors in the country, and it is also one of the sectors that has leveraged the enormous potential of technology in digital and clinical transformation in care delivery. It is designated as a critical information infrastructure under the Cybersecurity Act 2020, Act 1038, and a protected computer and critical database under Section 55 of the Electronic Transactions Act 2008, Act 772. Currently, we all appreciate that the healthcare institutions have deployed myriad of digital health infrastructure, encompassing artificial intelligence and machine learning, electronic health records, and other patient-centric systems, Internet of Things, digital and wireless enabled medical diagnostics equipment, MRI, CT scans, and the likes, surveillance systems for COVID-19 tracking and management, telemedicine is also, and teleradiology is also on the agenda, local and wireless area networks, web-based applications, that includes your website, the other applications that are web-based, medical mobile apps, telecommuting systems using the government virtual workplace, which is the smart workplace, and other ERP systems that you are using, including e-learning applications. So you can see that the health sector leverages technology, and it's critical that as we leverage it, we look at different things. So the use of technology in the delivery of care is highly regulated. This is worldwide practice because of the need to ensure that privacy, confidentiality, integrity, and availability of health data is readily made available for those who need it. There are patient safety issues as well relating to digitalization of the healthcare. Digitalization can be a life and death matter in the health sector. It is therefore imperative that NITA, as a regulator, exercises its full oversight responsibility in the digital space. The key objective of this health IT webinar is to provide insights on the technical, legal, and regulatory frameworks that serve as the building blocks for digital health. Additionally, NITA will this year commence the registration of IT professionals in the public sector, included companies also offering IT-related services to government institutions. The IT industry is highly specialized, and NITA will take the necessary steps to ensure that only IT professionals manage GOG IT infrastructure and systems. This is imperative so that we standardize this management across board. People with no academic education, technical certification, proficiency in the use of technology, and impersonating IT professionals are advised to desist from this practice. As we moved into this year, we've mentioned the critical information systems and all that. So with ourselves and the Cybersecurity Authority, we'll be looking at this thing critically to make sure that only people who are certified to manage government systems do so. This behavior constitutes criminal negligence when people are impersonating, people who do not have the right skills are impersonating IT professionals. And it's clearly enshrined in the section 117 of the Electronic Transactions Act 772. The doors of NITA are open, and we are ready to help and collaborate with any health institution and development partners in implementing systems based on the Ghana Enterprise Architecture and Interoperability Framework, best practices and standards. This is critical because there is a standard for enterprise architecture and interoperability. And we are currently even working with the Ghana Health Service to review their own health architecture. On that note, I'd like to thank you for your attention, and I entreat you all to kindly listen to what the other speakers would have to say and enjoy the seminar. So on this note, I wish you all well, and thank you very much, and Happy New Year to all of you. Raman, back to you. Thank you.
Thank you very much, Mr. Otri Ofosu. Thank you for the heads up on the registration and the professionals who will be handling the government of Ghana system. At least if we didn't take anything out of what you said, I know that there will be registration of professionals, and NITA is going to ensure and make sure that only certified people would handle GOG systems. Okay.
Indeed.
So we'll give way to Mr. Sam Kwashi to take us through the next agenda. So, Mr. Kwashi, please.
All right, thank you very much. Thank you very much. And I would also want to wish everybody a Merry Christmas and also a happy New Year. Yeah. Mabashi, I have IT for the Ghana Health Service, and my presentation would be on the digitalization in the health sector, with a focus on the legal, technical, technology-related, legal and regulatory frameworks. The presentation is going to be in two parts. I will handle the first part, and Mr. Musa Issa of the NITA Regulatory and Compliance Department would take on the second part. My focus will be on the impact of legal and regulatory framework in the digitalization in the health sector, and I would be focusing on the health sector component, on what needs to be done when try to embrace and adapt the use of technology in the health sector. So I'm going to start. I'll try and demystify the use of technology in the health sector, try and make it simple as possible, so we get a better grasp of what you need to do. Okay, so my outline will be, I'll talk about the digitalization process, what are the benefits of digitalization, the digital health ecosystem, what it comprises, or the structure of the digital health ecosystem, the objectives of the regulations, and finally, I developed a checklist that will help, I think would help the participants in addressing it. So this slide of mine contains some of the paper forms that you'd find in the hospitals that are not yet digitalized. So if you have been visiting the hospitals, especially those that don't have any computer systems, you realize they have a paper folder, there's a laboratory form, X-ray form, all of them are in the form of papers. Okay, so when you visit the physician, he takes your medical notes and is on the paper. Okay, so what happens is that all these documents, papers, are put in your patient folder, and each time you require a review, the medical doctor would have to pick the paper, your folder, go through your lab request forms, your X-ray forms, whatever test you have done, and try and recollect what your previous conditions was and whether it's improved. Okay, so it's manual. So which technically means that if you lose the patient folder, you have literally lost all your medical reports or medical history. The other challenge is that it also impacts on the continuum of care. So by continuum of care is if you have been visiting the Rage hospital and you get to move to another hospital, let's say in the Ashanti region or the Eastern region or Western region, the doctor there does not have the privilege of knowing what happened to you previously, unless you have your patient folder with you, or maybe you get them to write a medical report based on your past medical history. So this makes healthcare delivery very complicated. Even though we've done it over the years, it impacts on medication errors and medical errors, especially where they don't have any track record. I personally am allergic to penicillin. So if I don't tell you, or I don't tell a physician or nurse that I'm allergic to penicillin, as well as all the medication ending with sinsin and penicillin, azithromycin, streptomycin, all those things, and I don't take them. When I take them, what happens is I get very serious skin rashes, like my skin wants to peel off. So I don't think that, but somebody must know. So how would a person know if your system that you have in place does not afford physicians, or medical doctors or nurses the opportunity to have shared information on you? So it takes me to the main topic, which is digitalization. Now, you cannot talk about digitalization without understanding the processes. So the first step of digitalization, as I mentioned, is those paper lab results and X-ray and medical information in paper format to be converted into digital format. So before you undertake any digitalization process, you must digitize whatever existing medical records you have with you. So it can be incorporated into your digital transformation. You must have a strategy and a plan and objective on what you want to do. You must define the documents you want to digitize. You must prepare the documents, you must arrange them. So if you take a hospital that has operated for about 20 years, and now they want to use an electronic health record, they are torn between assuming there was no information in the hospital and also digitizing the existing medical records, so that if me, Sam Kwashi, have been attending the Rich Hospital for the past 20 years, and I have a very big paper patient folder, and now the Rich Hospital decides to automate. Okay, so the automation, in the automation process, they don't have to disconnect my existing medical records or reject it. They have to find a way of integrating that paper medical records into the new electronic health record that will be implemented, so that the new data or current data that is collected about me follows from the previous medical history, which have been in the paper format. So you go through these processes, and then at the end of the day, you have digital records in a format and appropriate fit to be integrated in any electronic health record or hospital information management system. Now, we move to digitalization. So digitalization is where you use the digital images or the lab images, whether it's in the form of PDF or JPEG forms, the X-ray forms, the doctor's medical history are converted into the digital format, and that digital format now using technology is integrated into a software solution that allows the physicians to now have a look at your past history digitally. So it's easy now for my medical records to be shared among participating hospitals or physicians if there is such a network in place. So the digitalization process starts with digitizing your existing medical records, moving it into a digital format. That digital format, using technology, is now converted into a format that supports connected, integrated, accurate data sharing and real-time decision making. That also involves following a process. So you must first and foremost, before you embark on any digitalization process, ask what does that mean for your business? Is your business ready for, your organization ready for digitalization? What information do you need that is making you thinking about digitalization? How would you make use of the information? What governance and compliance and system would you put in place? And then you start small. It's better to start small, identify the threats and vulnerabilities in your digitalized system before you go big bang. So I recommend you don't go big bang in any digitalization process. You start small, run a parallel system, so that in the event that there are some technical glitches, you're in a position to address them. Now, when you put all together, it's called, we are embarking on a digital transformation. You don't stand up and do digitalization. It doesn't work that way. Before any organization, a hospital embarks on digital transformation or digitalization, you must have a plan. Okay, so the digital transformation processes requires that you think about the technology that you want to use. Are you going to run some artificial intelligence system? Are you going to run an analytics? What about cybersecurity? What communication protocols are you going to use? Where will your data be hosted? Are you going to be using some IoT platform, that is Internet of Things platform? Is management ready for the digitalization? Does management understand what it means to embark on a digitalization? Do you have an IT strategy? What would the IT governance structure look like when you embark on a digitalization? What are the organizational forms that would have to be reviewed or implemented? Do you have the IT skill sets? A lot of the time, we think IT professionals are kind of one size fits all. No, you need multi-skills and area of competencies in a digitalized environment. How about change management? There are people, we refer to them as born before computers. They have very low or zero computer literacy skills, but they are very knowledgeable and experienced in the manual setting. How would you manage people like that? How would digitalization impact on the organizational culture? What business processes re-engineering would take place? What systems would be implemented? What data and information will be generated from those systems, and how would it impact on your operations and the products or services that you deliver? In the healthcare institution, the core service delivery is healthcare. The objective of any hospital or healthcare institution is to make sure we provide improved quality of care. How would the digitalization process lead to that or make it better? You need to think about it. What health outcomes do you expect from the digitalized undertaking? So you see that digitalization is not just about buying computers and software and getting internet and looking for somebody who is supposed to be good in IT. It doesn't work that way. It's a thought through back-to-back process, and all these thought through back-to-back processes that relies on IT framework, standards, protocols are regulated. They are heavily regulated because the healthcare industry is an information intensive industry, and this information intensive industry thrives heavily on the privacy, confidentiality, integrity, and availability of data. Digitalization is a life and death matter. If there is a patient is rushed to the accident and emergency center and your IT systems are offline, they don't know who the patient is. They don't know what his past medical history is. They have no clue what his allergies are, and there's basically nothing that could be done, or whatever could be done might not be very instrumental in improving the patient's condition, especially where we are running a paperless system where there's no manual records in the health facility or institution. So I'm going to walk you through what the legal and regulatory framework requires and prescribes, as well as the technical requirements when healthcare institutions embark on the digitalization process. The digitalization process, as I mentioned earlier, is a bottom-up approach. You start with digitization, you move to digitalization, and to make sure you use technology in a way that would digitally transform your business, you must have a digital transformation strategy. We have embraced technology in the health sector because it helps improve the quality of care. It helps improve the quality of care because there's real-time, accurate, and reliable data on patients. And this data is not only restricted to one person, but it's shared. So you can have multiple doctors making, providing their opinion on a patient's condition. And this makes it very good and helps improve the patient's condition. It also helps increase access to care. I mean, if you move from the urban areas to the rural centers and other communities, you realize that the kind of services, clinical services provided diminishes over time, over the distances that you travel. And not only that, the clinical or medical specialties you get to see or meet also diminishes or reduces as you move on. There is no way you are going to get neurosurgery services or some specialties in the rural communities or district. All those skill sets are available mostly in the teaching hospitals and in the urban centers. So using technology helps increase or making those services available to people in the rural communities. A clear case or excellent case is our implementation of the teleradiology system in the Ghana Health Service. Over the years, it's been difficult getting the number of radiologists required in the country. So what the National TB Control Program did as a strategy in the increased detection and management of TB cases was to procure connected digital X-ray equipment, which was distributed in over 60 locations. And in those locations, we just had a technician who would take your X-ray and whatever images that have been required or requested for by the doctor. This image is sent digitally to a command and control center, which is managed by highly skilled, experienced radiologists. They review it and then send their report or comments back to the initiating location where the image came from. And this helps the physician also provide better quality of care. So the patient need not travel from his or her location in the rural community to a regional hospital or teaching hospital to undertake that exam. So it helps increase the care. It also helps address the interoperability of data. When systems that are implemented are standards driven and based on IT frameworks and best practices, it's very easy to connect a system. So the X-ray machine and the pharmacy system and accounting system and the lab analyzers and the medical diagnostics equipment are all connected to each other, and it's better to get the patient medical records in a digital format in real time and also in an accurate time frame. Okay, so interoperability and data security is also addressed. Now, as I mentioned, integration of medical diagnostic devices are also very easy. Now, digitalization also helps in patient engagement. So SMS, social media, the other channels of communications digitally are used heavily these days in interacting with patients. Previously, patients would have to move from their homes to the hospital to get information on promoting healthy lifestyles or some information that is necessary for them to manage their condition. But these days, you can send them an SMS, the information can be pushed through the hospital's social media channels. You can also design and develop products or services, for instance, living a healthy life, eating healthily, and those other medical, information that helps in improving one's conditions and also reducing visits to the brick and mortar hospital. Patient experiences can also be measured. If a patient is very dissatisfied, he can go to the hospital's website and post a message and complain, or go to social media and post a complaint over there. This helps improving the management of information and also patient grievances, as well as also collect positive feedbacks on what people think hospitals must practices that must embrace in improving the quality of care. And then finally, analytics can easily be generated because you have the big data in one location. Now, compare a manual system with a digitalized system. With a manual system, to be able to identify data or report on data on how many male came to the female, how many male came to the female within a certain age group or bracket. You need to take individual folders and count 1, 2, 3, 4, 5. But with a digitalized environment, at the click of a button, you can generate data on the category of people, the sex of people, or gender of people come to the hospital, the top 10 diseases in the hospital, the top 10 medical condition, surgical medical conditions in the community or location where you find yourself. So digitalization is great and wonderful, but then it must all be implemented within a defined legal and regulatory framework. The digitalization being embarked on by the government of Ghana was conceived in 2003 and was enshrined in this document referred to as the Ghana ICT for Accelerated Development. Okay, so this document is a blueprint on the use of technology. There's a component on health that spelled out how the health sector is supposed to leverage technology in the clinical and digital transformation of the country. This document covers all the sectors in the country. So you find information on agriculture, interior, energy, health, education, everything is in here. So there is a strategic plan on the use of technology and also the digitalization. The current or ongoing digitalization being spearheaded by the Vice President was triggered or initiated under this regime, and so it's an ongoing process. Okay, so what the government of Ghana did, which I believe will be clearly spelled out in the outlined by the next speaker, is that to make sure that we have one fully connected and integrated sector or economy, they came out with what we call the enterprise architecture. So the enterprise architecture, I like to explain it by likening it to a situation where you buy a parcel of land, buy maybe an acre of land, you want to build on it, but you have a land. So you need an architect who will then help you design the image or structure that you want. So you need to figure out how many rooms you want, bedrooms, which one must be a master bedroom, the size of your kitchen, the size of your living room, whether you want a swimming pool, whether you want a garden. All this must be thought through before you start building. Same applies to IT. To start any digitalization process, you need to have an enterprise architecture spelling out what you want to do to ensure that you cover all the processes required to implement a successful solution. The enterprise architecture basically covers these domains. Okay, so in the implementation of IT systems, and especially solutions, you need to first think about what is referred to as the business architecture. So when it comes to healthcare, the business of healthcare is the delivery of care. We don't supply laptops or desktop or manufacture medication, no. So you must define what your business is. After you've defined what your business is, you must also define the interactions of your business, your internal interactions, as well as also undertake some business process reengineering So you cannot automatically move from a manual system into a digitalized environment. There definitely has to be a business process re-engineering. So you have to have your business architecture. Then also you need to define your data and information architecture. Now, as you all may know by now, data is now an asset. Data is an asset. So you must define what your data format and structure must be. You must also identify which aspect of your data will be shared and the common vocabulary for your data security. How do you integrate data from other systems into your systems, your central management system? So you must think about all application do you need to design and roll out to enable you generate the data that you need that will drive your business processes. That needs to be spelled out. So in the health sector, we don't only use hospital information management systems. We have an ERPs that HR uses. The finance people have the ACPAC accounting software. They also use the gift mix. We have telemedicine implementations. We have medical mobile apps. We have websites. We are now using social media. You develop you think through and develop all these implementations at the application architecture stages. And then when it's done and dusted, you figure out which technology architecture is going to be rolled out. So in the technology architecture, you want to make sure it's based on requirements. You don't buy laptops and tablets just for the fun of it. No, it must be based on your requirements and also based on meeting your business challenges. You must also identify and also work around interoperability issues. So you don't buy different systems, equipment that cannot connect to your integrated software solution that you are using. You must define the kind of local area network and wide area network structures that are going to implement your solution, as well as also define or determine your connectivity, internet connectivity, storage, using cloud, remote access connectivity. You need to develop and come up with some system or structure under the technology architecture. Once you've gone through your business architecture, your data architecture, your application architecture, and bought all your servers and all those systems you need to operate, you have to now get to the stage where you ask yourself, so how do I secure the infrastructure? And how do I also comply with the legal and regulatory framework? So this must be thought through. You must also think through about the IT governance systems or architecture that will be implemented to ensure. So by IT governance, I mean the top level organizational or institutional processes relating to your strategic alignment with your businesses and technology. How do you align them? How do you also ensure that you get value, IT value delivery, get value from the millions of dollars or cities that you would invest in the IT infrastructure? Like I mentioned, you don't just buy tablets or laptops or servers or invest in software technology for the fun of it. There must be a reason why you are making that investment. And that investment must yield a positive result and must also improve on your business operations. You would have to undertake a risk management, undergo a risk management processes before you roll out the technology, and also figure out where you're going to get resources to fund the investment you're making in technology, not only in year one, but in subsequent periods. So there's the phrase that is used in the IT industry, which is your technical sustainability. What systems are you going to put in place to ensure that you have adequate resources to guarantee that your IT investment will be sustained over a certain period of time? And also, how would you refresh your system? Technology related items get obsolete over time, and you would have to replace or update or upgrade either your equipment or software implementation, or sometimes licenses requirement. You must have funding for it. And then finally, how do you measure the performance of your IT infrastructure? So the digitalization infrastructure, or the digital health or e-health infrastructure must be measurable. You must have a system, some benchmarks that you would apply to figure out whether this whole digitalization agenda whether it's worth it, or you just have to scrap and go back to your traditional way of doing work. IT project architecture. IT is a major game changer. Poorly invested IT implementations have resulted in major failures and has also led to the collapse of businesses. So you would have to adapt IT project best practices. You would have to initiate your project. If you are using a project management framework, you have to undergo a project initiating. You have to plan your project. You have to have a team that would execute the project. You have to have a monitoring and evaluation framework. And finally, you have to close the project properly. And sometimes we implement projects, and then it gets to the stage where we get to project closure, and then we are now looking for who would manage your project or systems or solutions that has been designed and developed. Because when these things happen, it tells a story, and the story is simply that it didn't go through any IT project system or framework, and things like that have resulted in major project failures. Performance benchmarks must also be clearly defined and communicated and implemented to enable management advise and also allocate resources to the investments. Okay, so in the digitalized environment, you have to make sure you abide by these practices or best practices to ensure that it's successful. Now, I want to walk you through the digital ecosystem in the health sector. I don't know if you can see clearly, but I undertook a quick assessment and identified these implementations or innovations or interventions being implemented in the health sector. Okay, so what you find out when you visit any healthcare institution or any healthcare organization is, when the software application, you realize we have several software applications ranging from server applications to Microsoft Office applications, Apple Macintosh applications, productivity software such as Adobe Reader, the Architect, ArchiCAD, what do you call it, analytics software. We also have the electronic health record, that is the hospital information management systems. We currently have the international building, what do you call it, building management, integrated building management system. Most of the hospitals that are being put up now are smart hospitals. So the lighting system, the AC, the door locks are all connected to the IT infrastructure. So technically, if you're an IT professional and you know what to do, you can literally shut down the lighting system in the operating room and lock the physicians in the operating theater, turn off the lights, because there is an integrated building and management system. There's also the ERP, so the HR people have their software for managing staff. The logistics management information systems is used for supply chain and logistics management system. The finance division have the ACPAC and other software solution for preparing financial data, financial reports, and other management report. So this is one. There's also the telemedicine ecosystem, where we have teleconsultation applications, teleradiology, we have telelaboratory implementations. Within the context of network infrastructure, we have smart hospitals infrastructure. the smart hospital infrastructure is very different. The networking equipment and software applications and the networking and monitoring and management systems are usually highly advanced and not common, and you require some highly skilled competencies to be able to manage the new hospital systems that are being put in place. Internet connectivity, cloud computing and hosting services, local area and wide area network, as well as the networking in the hospitals. Then in terms of communication, there's also voice over IP. Now, with regards to people, in a digitalized environment, there are several categories of people issues that you need to address. One is the health IT professional, the IT people. There's also the health professionals themselves, the doctors, the nurses, the pharmacists, the accountants, and the lab technicians. You need them. Then you also need to address third-party access. So most of the time we implement system solutions and we don't build the full capacity required to manage it. So we give access to third parties. So like X-ray machines, MRIs, you realize that the technicians have remote access to the infrastructure, and you need to manage their identity and access to your IT infrastructure, since it has security implications. You need to manage change. How do you get somebody who has done manual work for 25 years or 30 years to work in an environment that is now there's no paper? You need to manage the perception, the computer literacy skills, both competences to get that done. There's also the biomedical digital devices, so the digital laboratory equipment, the CT scans, the MRIs, the connected wearables, the picture archiving and communication systems, and the servers that manage all the images that are captured from the X-ray machines, and as well as dealing with the medical integration of devices into the local area network or wide area network. You want to make sure that if you have a digital X-ray machine or MRI and it is connected, how do you ensure that an X-ray of Kojo Mensah is that X-ray that is going to the physician and not the X-ray image of Mrs. Flora Amponsa? So these are all issues that need to be dealt with. There is a cybersecurity component. Healthcare institutions have been designated as critical information infrastructure under the Cyber Security Act 2020, 1038. How do you manage the the CII status of these institutions? There is also artificial intelligence. There are some solutions in hospitals that use artificial intelligence and machine learning systems. So there's artificial intelligence in clinical diagnosis, artificial intelligence in surgery, artificial intelligence in medicine, and also artificial intelligence in clinical assistance. There's social media, Facebook, Twitter, WhatsApp, Instagram. There's also the myriads of computing equipment, laptop, desktop, printers, photocopiers, multimedia equipment, storage equipment. You have to deal with data governance. How do you classify health data? How do you deal with the intellectual property and copyright issues? Data storage, do you know where your data is? The data that your digitalized or digitalization devices or the systems you have embraced, do you know where the data is? Is it in-house? Is it in the cloud? If it's in the cloud, what security protocols have been implemented over it, and who owns that data? You must decide on all these. And then finally, or last not the least, there's also smartphones, the use of smartphones and tablets, medical mobile devices, and web-based applications. So not to also mention emerging mobile payment platforms. So if you have integrated a payment platform into your network architecture, you realize that the digitalization that we've been talking about is not just a simple process, because managing this infrastructure or ecosystem cannot be done by one person, and you need to have some highly skilled competences to be able to manage this infrastructure and also comply with the legal regulatory frameworks impacting on this. Now, from what I've outlined, you can glean three key domains or components from it. They are the people issues. In any digitalization undertaking, the people issues, and then issues related to technology. So you'll be surprised to find out that our legal and regulatory framework addresses these three key what I call it domains and its frameworks. Okay, so what are the objectives of the regulations? Why do we need a Data Protection Act? Why do we need a Cyber Security Act? Why do we need an Electronic Transaction Act? Why do we need all these? Okay, we need them because in a healthcare delivery, patient data is crucial. There is a need to preserve the identity and sanity of patients, and not only patients, but the data that is collected. So protecting the privacy and confidentiality of data is highly regulated in the healthcare industry, nationwide, worldwide. So we have the Data Protection Act handling that. There's also the need to address patient safety. You want to make sure that if you embark on any digitalization agenda, the system that you implement is available, 99.8 or 9%. You don't want a situation where a patient goes to the hospital and you tell him it's offline. You can liken it to trying to take some money from an ATM where you go to the ATM and the ATM tells you it's not functioning, and it happens over and over and over again. Yes, the ATM, you can decide later on in the working day to go and write a check, go to the main banking hall and take some money. But then in healthcare, you can't do that. It's a matter of life and death. So there are legal and regulatory frameworks that deal with patient safety. There's also the need to promote best practices and standardization so that the hospital IT systems or digitalization system implemented in rich hospital talks to a hospital in WA, a hospital in the eastern region, a hospital in the central region, a hospital in the Ashanti region. So there's a need to address the best practices and standardization, as well as also address IT governance. IT governance is the bedrock of digitalization. If you have a very weak or non-functional IT governance, I tell you, I mean, you don't need a prophet to tell you, it won't be long before your whole system breaks down and collapses. So these legal and regulatory frameworks are very strong on institutionalizing and promoting best practices in IT governance. There is also the need to ensure transparency. You don't want software developers developing softwares where you can't have access to the source codes, you can't review the source codes, where they will also lock you in. So if you buy, I recently asked a hospital, a private sector hospital, whether the software belongs to him, and he said no. So I said, what about the patient data? Because when patients visit a hospital, the hospitals owes the patient a responsibility and a duty of care in ensuring that the patient data remains in a hospital. So then if you are running a system on implementation where you don't know where your data is, you don't even know if you own the data, that is troubling. So all these legal and regulatory frameworks seeks to ensure that not only is there transparency, but also there are some benchmark or indicators for measuring your digitalization progress. And where you do not comply with it, there are prescribed sanctions and fines. Okay, so I'd love to share this slide on why implementation fails to meet their objectives. This is a research that was done in 2003 by the BLCN Incorporated Management Consulting. Now, when they did this research into why IT implementation failed to meet their objectives, not only IT implementation, but digitalization and any kind of digital transformation processes, it was found out that 32% of the reason why technology fails is due to leadership. Okay, so leadership not participating or not showing a willingness and providing the necessary direction and resources and political will to embark fully on the digitalization agenda. There's also the mixed feeling or mixed messages that leadership sends out. So you don't see management playing a key role in the digitalization agenda, and also who owns it. Okay, who owns the systems or infrastructures and software applications, being implemented. When these signals exist, 42% of the time it can lead to project failure. 27% of the lack of a proper and structured organizational system also is a major contributory factor, as the research indicated. So if your organization has not embraced on best practices in the implementation or adoption of technology, it would contribute 27% to a failed project. So the organization haven't got a defined structure for the technical team or people involved in the digital transformation processes. They are not involved in decision making. You can see clearly that this organization is not ready to embrace the use of technology. And then finally, they are clueless. I have met top management officials who are very clueless about the thing they talk about. Sometimes I recall a couple of years ago, somebody telling me he or she doesn't believe in antivirus software. He doesn't believe there's anything like a virus. He doesn't believe that it's possible for somebody to hack their systems or gain unauthorized access to their systems. So if you have to be dealing with people like that, then how do you get around a situation where you'd have to request for the procurement of antivirus software or firewall solutions, or even undergo training for cybersecurity? It's difficult, and from the organizational perspective, 27% of the time they contribute to project failure. In addition to that, the people issue also contribute 23%. So you don't have people with the appropriate competences. I like it when the Director General of NITA in his speech said that, it was very categorical and said people who don't have the academic education, the technical certification and proficiency in the use of technology have no business advising or making management decisions, because they play a very bad role in the forward move in terms of the adoption of technology. Adoption of technology requires some structural changes in the HR. So you need people with competencies and skill sets like systems administration, database administration, cyber security, programming. You need all these categories of people. So when these competencies and skill sets, in addition to a defined job description, is not designed and developed in the organization embarking on digitalization, chances are that you will not make any significant headway, as well as making sure they have the necessary and relevant operating logistics and training needed to support their work, the work that they do. Interestingly, technology contributes only 4% to project failures. So then the question we ask is, why do we spend a lot of time on the procurement of laptops, desktops, servers, tablets, and solutions, when at the end of the day, based on this research, if you add it up, the total of 42% plus 27% plus the 23% means that a critical success factor digitalization undertaking rests on people. We have the National IT Agency, which was created by an Act 772 in 2008. We have the Cyber Security Authority, which was created by an Act in 2020. The Data Protection, which was created by Act 843 in 2012. We have the Ghana Audit Service, which was created by an Act 584 in the year 2000, and the National Communications Authority, created by an Act 769 in 2008. So it's important to state that these regulators have legal backing. They can sue and be sued. So the acts the provisions of the acts, when they are breached or violated or infringed upon, constitute could constitute criminal negligence, willful negligence, and it could be sued in a court of competence and jurisdiction. These regulators all oversee the digitalization process in the country. Okay, I'll speak about them in the subsequent slides. Now, in the legal and regulatory frameworks, and before I continue, I have provided you with the URL for the NITA. So if you go to www.nita.gov.gh/NITA/resource/center, you would get soft copies of all these legal and regulatory frameworks. So you get a copy of the Electronic Transaction Act, you get a copy of the Data Protection Act, you get a copy of the Cyber Security Act, the National Information Technology Agency Act, as well as the National Communications Authority Act. I would advise that you would go online and download copies of it, since both myself and the next speaker will make reference to the provisions of the Act, so we are all abreast. I'd also ask the organizers of the program, if they have soft copies of it, also to post it on the platform so you can download it. So the Electronic Transaction Act provides some rich information on the use of technology in the health sector, and also the Data Protection Act also talks about what you need to do to protect data. I'll speak about it in my details. The Cyber Security Act prescribes what needs to be done. And the National Information Technology Agency Act provides details of the authority of the National IT Agency. The National IT Agency is the regulator of the digital workspace, and they have some very strong mandate in the space, and I'm sure it will be spoken about. So I'm also repeating the URL again so you can download it. It's www.nita.gov.gh/NITA-resource-center. Now, under the legal regulatory framework that I mentioned, in the healthcare ecosystem, Section 55 of the Electronic Transaction Act, it's supposed to be 2008, Act 772, recognizes that healthcare institutions, healthcare systems as protected computers and critical database. So Section 55 of the Act has categorized that computer systems, networking infrastructure, and equipment are regarded as protected computers and critical database. Section 35 of the Cyber Security Act 2020 also designates healthcare systems as critical information infrastructure. Now, these designations come with mandatory implementation operational requirements by force. It's not discretionary. You cannot say that you would implement a solution that is used for collecting patient data, processing the data, storing it, sharing it, and you will not comply with the Act. That constitutes an infringement on the Act and attracts some penalties and sanctions under the Electronic Transaction Act. So if you are an operative in the healthcare ecosystem, please be advised that your infrastructure constitutes a protected computer and critical database, as well as a critical information infrastructure. Now, to address the challenges that institutions would be confronted with, what the National IT Agency and the other regulators like the Data Protection Act and Cybersecurity Act have come out with some guidelines and best practices and procedures that must be adapted in the use of technology. We have the Public Service ITIM scheme of services. This public sector ITIM scheme of services is the manual for recruiting and also giving directions on the organizational structures that might exist in public sector institutions and other institutions that seek to leverage the power of technology in their business undertaking. The public sector ITIM scheme of services recognizes that in any institution that have deployed systems or have embraced technology in its business operations have to set up 3 structures, categories. The first one is a directory. Second one is a department or a division, and the third one is a unit. So if you are running an institution which has between 2 to 5 IT professionals or digitalization team, you are required to create an IT unit. And this structure or recommendation is also based on size. The size of your business operation is also based on the dispersion of your business operations. By dispersion, I mean, do you have regional or district or community representations of professionals in your organization? It's also based on the complexity and sophisticated nature of your IT infrastructure. I walked you through the digital health ecosystem of the health sector, and you can imagine the complexity involved and the chaos that will arise if you don't have any defined structure based on world standards and proven practices. Okay, so unit is for a staff strength of between 2 to 5, between 5 to 10. According to the Public Service ITIM scheme of services, you have to set up a directorate. And then over and above a staff of 15, it has to be a directorate. It's been clearly defined, and the reasons why these structures must be put in place, as well as the career progression path in this organization have been clearly outlined. This was put out so that you would know what to do. In addition to that, the National IT Agency, which is NITA, has also come up with a standard that allows it to give guidance on IT governance. There's also IT frameworks and best practices to help institutions embrace the appropriate technology. In addition to that, there's also the technology standards for processes and technology. So we have the enterprise architecture, we have the electronic government interoperability framework, we have the national IT agencies standards and best practices, we have the National Health Insurance Authority's e-claims interface standards, and we have the DIMS2 standard operating procedures and the recently promulgated e-pharmacy guidelines. So there is a need to comply or adhere to the provisions of all of these in any digitalization undertaking. Now I'm going to walk you through some of the standards NITA has come out with. NITA has come out with an IT standards on data center, management of IT infrastructure for the MDA. There's a LAN and WAN standard and the disaster recovery and backup policy. There's also the IT governance, as I mentioned. There's a standard set applications standards, And then finally, there's electronic records and data management standard. Now, there's also the penalties, fines, and sanctions. I'll quickly run through this as it will be a lot more information will be provided in details by the next speaker. So when you breach all these legal and regulatory frameworks, there's the criminal negligence component, there's an unauthorized access to protected computers. There's also the unauthorized access to devices. There's unauthorized access to stored communications. And then there's unauthorized access to computer program and electronic records. There's unauthorized access to modification of computer programs. The two sanctions that I fear most is the unauthorized disclosure of access code. This comes with a jail term of 20 years. Okay, I also I'm scared of the causing computer to cease function. Now, causing computer to cease function, when you read it, which is section 134, when you read it, it points to the fact that you can be prosecuted by your conduct. So if you're a manager of an IT institution, if you are CEO or director general or whatever position you hold, and per your conduct, you deny IT professionals, logistics, they are intimidated, you don't support them in the work that they do. And if you put all together, and it can be pointed out to the fact that your conduct has affected the computing operation or digitalization agenda, if there's evidence, there's documentation to that effect, you can be prosecuted and the jail term is 10 years. If you are also an IT professional and you undertake and you refuse to undertake an IT undertaking, or you engage in an ethical practice, and that ethical practice causes the entire digitalization or computer function, you could also be prosecuted and jailed up to a term of 10 years. There are also some fines components. So it's very important we pay attention and understand these issues. Now, I took a checklist of all these legal and regulatory frameworks that you need to comply with. So under the Electronic Transaction Act, I identified some 11 pointers that you must know and check to identify and satisfy yourself whether you have complied with the technical, legal, and regulatory framework. So these are the 11 pointers. There is also the pointers for the Data Protection Act. The most important ones are the fact that if you embark on any digitalization in the health sector, according to section 27 of the Data Protection Act, you must register as a data controller. A data controller is an organization or an individual who has implemented a system that is used to collect data, personal data of individuals. So you must register. And then when you register as a data controller, you must also implement some security measures to address the security, confidentiality, and privacy of the data that has been collected. If you are a data controller, which is for instance a hospital, and you outsource your data processing function to a company, the company must also be registered under the Data Protection Act through the Data Protection Commission. So those of you who have software that has been designed and developed by software vendors, and those software vendors are the people in charge of your data processing, be advised that you have to make sure per the Act, they register as a data processor under the Data Protection Act, as well as also comply with some security measures that has also been outlined in the Data Protection Act under section 28. The Data Protection Act is strong on security measures, making sure you have an IT security person, you have a well-defined organizational structure, you have embarked and embraced on IT governance and systems, and you adapt protocols and software solutions to protect the data that has been collected. When there's a data breach, according to Section 31 of the Data Protection Act, you have to notify the individuals, which means that if you are developing a system, you must design it in a way that you can have the individuals on the system that you are collecting the data on. Individuals under Section 35 have rights to their personal data. When an individual is very dissatisfied under Section 77 of the Act, they can request for assessment with a view to determine whether your software implementation has complied with the Act. And when the Commissioner of the Data Protection Act undertakes his investigation and it comes out that you have not complied with either the Electronic Transaction Act or Cyber Security Act or Data Protection Act, the Section 43 of the Data Protection Act empowers the individual to sue the hospital for failing to comply with the legal and regulatory framework. So as we embrace digitalization, we must also be mindful of the risks involved in the whole process. And then finally, the Cyber Security Act also, I came out with a few checklists which you must all address, which is you have to understand that you, in the healthcare industry, you are designated as a critical information infrastructure. The Minister of Health and Digitalization recently came out with a list of institutions that have been identified as a critical information infrastructure. It was gazetted. I think I saw it in the daily graphic, and I also found it online. It's available. You can make inquiries at the Ministry of Communication and Digitalization. I'm sure you would be provided with information infrastructure. There are prescriptions on how your status as a critical information infrastructure must be managed. So if you recall, I made mention on the fact that under Section 59 of the Electronic Transaction Act, the Minister of Communication and Digitalization has the mandate or has the sole right to prescribe what systems you must put in place in your hospitals. The Director General, the CEOs, the head of management have no business deciding what organizational structure or business or IT governance mechanism must put in place. It has all been defined, and all healthcare institutions, especially those in the public sector, are supposed to do is just to copy and paste. And so you can be cited for criminal negligence if you put in place any system that is not consistent with the provisions of the Act. So same applies to the Cyber Security Act. Okay, the Cyber Security Authority has, under the Act, established a computer emergency response system. The National Cyber Security Authority is the only mandated institution responsible for fighting cyber threats and attack in the country. So if there's a cyber breach on your system, you are duty bound to report it to the Cyber Security Authority under Section 47 of the Data Protection Act. You don't report it to anybody else except the Cyber Security Authority, which presupposes that you must have a system in place that is used for capturing and reporting incident breaches. According to the Act, you have to report this information to the Cyber Security Authority within 24 hours. And then Section 48 prescribes the point of contact, people you have to contact or inform when there's a breach. So this is a checklist that I believe will serve as a guide as you embark on your digitalization agenda. I hope I have succeeded in demystifying the technical, legal, and regulatory framework. I am done with my presentation, and I would respectfully ask that you write your questions down so that at the end of the next presentation, we do a joint Q&A session, because my presentation and the next presentation, there are going to be some overlaps, and some of the questions will be answered by or must be answered by the next presenter. With that, I want to thank you for listening to me and also participating in the webinar. Thank you.
Thank you very much. So without taking much time, we want to introduce Mr. Musa Isa. So Mr. Musa, please, if you're ready for us, we are also ready for you. But before, please hold on a second. Before you start, we would want to have about 10 minutes break, if that is okay with you. So participants would want to take a 10 minutes break. Please stay connected. Make sure you have a seamless connection, so you wouldn't be going back and forth the connection and entering the webinar, because we noticed some participants kept going on and off, and we have to be on guard to admit them from the lobby into the webinar. So please make sure you have a good connection. Thank you very much. We would resume in 10 minutes.
Yes, sir. You talk.
Okay, you did it.
Hello, everyone. Welcome back from the break. That was 10 minutes of stretching our limbs and enhancing blood circulation in our body. So, we would want to continue with our presentations. Next, we have Mr. Musa Isa, the Regulations and Compliance Deputy Director of NITA. So, Mr. Musa, please, if you can hear me, I would like you to say hi to myself and the participants and proceed. Hello? Welcome back, everyone, from the 10 minutes break. That was 10 minutes of stretching our limbs to enhance blood circulation in the body. So without taking much time, we would want to continue with today's presentation. And before that, Madam Teresa Seko, please, we have received your question and have incarcerated it to the end of the presentation. Then we'll make it known to everyone, and we will make sure you are answered. So next, we have Mr. Musa Isa, the Regulations and Compliance Deputy Director of NITA, to take us through the next stage. So Mr. Musa Isa, if you can hear me, kindly say hi to myself and the participants, then proceed. Okay, so I assume Mr. Musa Isa is not ready yet. We'll give him some 2 to 3 minutes to get back to us. Please stay connected. Thank you.
Good afternoon. Good morning to you all.
Good morning, Mr. Musa. You're welcome
Yeah, good
back.
morning.
We were waiting for you.
Sorry for
So since you're here
delay.
now, oh, that's fine. That's okay. We hope you had a good 10 minutes break. So we are all here ready now for you. So whenever
Absolutely.
you're ready, you may proceed, please. Thank you.
I'm ready. I don't know whether I try sharing my slide. Let me see. Okay. No.
Okay, I think the slide
This
is visible now.
no, this is a wrong slide.
Oh, okay.
Yeah. Okay, I think Rahman, have you allowed me to?
Yes, currently we
Okay.
can see your PowerPoint. I would suggest that you switch
I
to
think
presentation.
I think that is it. That should be the old slide. Let me see. I'm finding a challenge here.
Mr. Musa, please, is everything okay?
That is what I'm trying to. I can't. My slide is not visible with me here.
Oh,
I'm wondering what the challenge is. Let me.
okay, Mr. Musa, please, can you please try on sharing and resharing again?
Okay.
Yes, please.
Uh, I've shared my presentation, but I'm wondering why I can't see it here.
So me, if I dey watch these things, it be say
Hello, everyone. Kindly stay connected as the issue at hand is being resolved. Thank you. We'll get back to you soon.
Hello, please, can we use this opportunity to ask questions to Mr. Kwashi?
Um, Hello, Mr. Musa Isa. So, your slide is visible to us now. If you can hear me, you can kindly unmute yourself. We can see your slide now, your presentation.
Thank you very much for your patience.
You're welcome, Mr. Musa.
My presentation is going to be how the regulator will create an appropriate environment for the players in the sector to implement their digitalization program successfully. And we'll look at the standards, the frameworks, and then the legal issues with respect to digital health sector implementation. We'll look at the background to digitalization in Ghana. Then we'll look at the institutional mandate, the digital implementation, the legal infrastructure, and the regulatory actions that need to be taken to ensure that we succeed in our efforts to digitalize the health sector, digitalize the country and the health sector as well. I don't know whether, okay, what the government did to digitalize this, the country was to identify a need, and that need saw ICT as a pervasive tool to enhance our day-to-day activities. And this knowledge of that, we saw a number of challenges that, if any at all, want to implement our digitalization problems, we will face in our efforts. So government put these challenges in perspective. The challenges of technology, the challenges of human resources, and the challenges of our behaviors as we implement the digitalization. Having known these challenges, efforts were made to provide solutions to these challenges before even we implement them. And we also realized that there was the need to look at the conformance aspect of this digitalization, where players must comply with basic regulatory framework and policies to ensure that, yes, we move as a whole to achieve success in whatever digitalization we are doing. The health sector happens to be very progressive in the digitalization efforts since inception. This culminated into various ICT initiatives that government implemented. And these initiatives were undertaken to ensure that we have quality information communication technology. And we use best practice and standards to guide us. To have this in our process of implementing this digitalization, there was a need to develop policies, laws to support regulation. This came with the development of a blueprint, ICT for accelerated development, which has been a major document guiding us in this our digitalization effort. This document sets 14 pillars to help us achieve this effort. One pillar, the first pillar, was accelerated human resource development using ICT to ensure that human resource, which will be a major factor in implementing digitalization, is achieved. The second one was to promote ICT in education. We have facilitating government administration and service delivery. That's where we saw the promotion of electronic government and governance. Then we have facilitating the development of the private sector. The rules, standards, the legal system to help enhance the private sector operations. Those are export-led oriented ICT products and services. All these are pillars which will guide all the sectors, and pillars specifically targeted to the sectors involved. We have that of health, ICT for health. We have ICT and enabling physical infrastructure development. So these are the guides to any ICT investment and development that is undertaken by all the sectors in the country. To ensure that these focus areas, the priority areas are achieved, there was a need to set up institutions to coordinate and regulate ICT in Ghana. And the mandate was given to this institution by Act 771, which we call the NITA Act. Indeed, NITA is supposed to oversee the implementation of any form of technology among MDAs and regulate ICT as a whole. And this mandate first is to regulate the provision of information technology to ensure that the provision of quality information communication technology and to promote standard of efficiency and ensure high quality of service. Indeed, this mandate ensures that everything of IT must be done through NITA. NITA will guide to ensure that whatever ICT service you are delivering it on a higher quality. And you observe all the standards that is supposed to be observed, and also the quality of information that you are providing. So these are what mandates NITA to do what it is doing today. As we go, subsequent slide will indicate exactly what NITA is and what NITA is doing to achieve that. NITA is not alone in this sector. This sector is huge and it has so many areas of digitalization, areas of ICT or digitalization issues that must be tackled as a group. So we collaborate with other mandated institutions like NCA. NCA is mandated to regulate telecommunication. We have cyber authority. There is no digitalization that will be done without security considerations ensured. We have a collaborating partner with Data Protection Commission. The audit service is also a major force in regulating ICTs in Ghana. So these institutions are collaborating to ensure that ICT is implemented in its best form to achieve success. Without these institutions involved, ICT implementation would have been will go haywire because everybody will be doing what it thinks is best for him. The major document, legal document that guides NITA is the Electronic Transaction Act. And in the Act has specified what to do, what not to do, and also guide us as to how we implement our initiative successfully. For instance, in the health sector, Section 55 speak of protected computers and critical databases. And the health sector is a critical sector that borders on human life. Therefore, the framers of this act saw it wise to have sections to deal with how to manage implementation of any digital endeavor. E-health, health digitalization comes under this act, this section. Protected computer, whatever systems or computers you are using to deliver care is described as protected. And then the database that your information sits on is also described as critical database. And therefore, we have guidelines how to manage these protected computers and critical database. Going out of these guidelines will amount to legal jeopardy, because it tells us anything contrary to what the law says will be an offense. And therefore, we have a number of offenses that, sorry, when you go against, there's a consequence that you should pay for. For instance, admissibility and evidential weight of an electronic record. The law courts will admit evidence based on electronic evidence. That's if your log record shows how certain infractions was carried out, the law court will take up against will take up these issues and you'll be prosecuted. So we should know what exactly it is that we should not do or we should do. The act specifies clearly what you should do and not do. Let's be mindful of the, indeed, this is very critical for IT officers. Sorry to say this. The tendency for you to be instructed to do certain things without following best practice, without following what the law says do or not to do, will have an impact on you. And you should know, you should up your skills and know what the law says. We have the enterprise architecture, which also indicates how IT should be implemented, how digitalization should be, especially adherence to the standards and protocols. IT officers must know and not be pushed into doing things that eventually will be outside the standards or outside their scope. Yes, at times one is forced to do certain things for and because you don't have any power, you are cowed to do it. That is also a challenge that these documents are guiding you to raise issues. Tell your superiors that no, this the document says A, B, C, D, so that you will not be found wanting when the day of reckoning comes. The Act also focuses on addressing interoperability. Interoperability simply enhances the interaction between among systems or institutions. The institutional collaborations that we have with data protection, institutional collaboration that we have with cyber authority is based on what their act says that borders on digitalization. For instance, section 17 to 22 deals with privacy of personal data. And then the guidelines for which you collect data, you collect personal data, or you process personal data. Here, you don't just get up and start collecting data. You must follow the protocols. You must register as a data processor or data controller. And indeed, with this, you have to train the personnel involved, and the data supervisors must be trained. If an institution, especially the health sector, where data collection is key, you should have data supervisors. You should register as a data collector, or register as a you register to let's look at the act once again. Having to register to collect data has an implication, and then the implication is that if there's any infraction as to how you use data, you stand to answer the data commissioner, and it goes with fines. Big institutions have every now and then get fined for breaching data protection standards. And there is an enforcement mechanism that goes with that. Cyber security authorities are mandated to ensure that the cyber space in Ghana is secured. Therefore, they bring in policies, guidelines to ensure that this is religiously followed. For instance, the Cyber Security Authority, through the Ministry of Communication and Digitalization, gazetted cyber critical infrastructure, information infrastructure owners. And the health sector, as I mentioned, is key, and they are critical information infrastructure owners. And a mechanism to ensure that health data and then the health sector infrastructure is secured are given out. the sort of people you need to manage this infrastructure has been spelled out clearly. You don't just get anybody at all to be a cyber security officer or IT security personnel. No, they have categorized who should be the qualification involved in becoming an IT security for your installations, and then the processes are also clearly defined. So you need, these are regulatory issues that you need to observe before you can secure your entire ecosystem. Without observing this, you have a challenge to work with. Review audit service is also an institution that we are collaborating with to ensure that there is governance in the way we do things, the way we implement our IT programs. Audit service will do audit to find out whether your programs or what your IT implementation is aligned with your business strategy. So look at IT value delivery, look at the risk management protocols that is in place, and also look at how do you allocate IT resources. How do you invest in IT? Is IT performing as you have indicated? How did you procure the IT infrastructure? Did you follow laid down policies as described by the enterprise architecture or the interoperability framework? These are major issues that audit service will raise, and NITA will come in. NITA will also do their audit. NITA will collaborate with audit service to do IT audit to ensure that IT provide the maximum service that is required in your organization. And we'll look at the processes involved. We'll talk about the standard that we have developed and how the standard will help in curing some of our activities that hitherto is not allowed. Yes, in the regulatory environment, we have to classify the health ecosystem into two. And these are gotten from the two laws that we have. One, the law 772, that is the Electronic Transaction Act, and then the Cyber Security Act. The Electronic Transaction Act has classified the health sector as protected computer and then critical databases. And then the guidelines for addressing issues of protected computers and critical databases have been made clear. Just in the same vein, we also have the critical information infrastructure owners. What this means is that you need to be careful when it comes to these two classifications. You need to follow exactly the protocols, the guidelines as described by the two acts: how to handle issues that relate to critical database and protected computers, as well as how to handle issues that relate to critical information infrastructure. We'll look at having known these things, having known what the legal environment is, the regulatory actions that need to be done by NITA to ensure that we maximize our implementation efforts to achieve success. For instance, we have a very important document that standard that guides the whole digitalization ecosystem, and that is the enterprise architecture. This document is meant to guide and enhance how digitalization should be. Without observing this document, whatever digitalization effort we do will not give us any success. We'll be doing firefighting. In this document, we have governance of IT. In this document, it gives us how to enhance the various systems to talk to one another. In the health ecosystem, Mr. Kwashi mentioned a whole lot, and it looks as if the digital health ecosystem is very huge. Sorry. And we can ask questions. Are these systems aligned with the business goal of the sector? Are the people managing it trained to manage it? Do we have the necessary skill set that will ensure the sustainable use of these systems within the ecosystem? There are more questions we can ask. But if we are observing the enterprise architecture and we are using it, these questions wouldn't be asked. Indeed, because it is an important document, and Ghana Health Service being also an important sector that protects life, NITA helped Ghana Health Service is the first sector of government to develop its own enterprise architecture after the national enterprise architecture. The reason being that IT or devices can kill in the health sector if they are not managed properly. That is a major reason why the national health sector enterprise architecture was developed. And I wonder whether we are implementing this enterprise architecture. There were occasions when people from the health sector will say we don't need an enterprise architecture, and that is a smack of not having the correct knowledge and temperament of IT, because enterprise architecture is the bedrock of IT management or implementation. IT governance or governance of IT is also an important aspect in this our digitalization effort. And the role of NITA is to evaluate, to direct and monitor governance, IT governance within the ecosystem or within the sectors of our economy. And we are doing this in several ways. Having looked at this enterprise architecture as a major area of conformance, there are three areas that we always talk in IT management. And these areas are people, process, and technology. And these same areas form the bedrock of IT governance. To succeed in whatever we are doing with digitalization, we can do away with the people involved. We cannot also do away with the processes and then the technology that supports. They interlink and all must be in motion to ensure success. Do we have the right people doing the right work? Have we set the process clear that is coherent and seamless? The process must be such that whatever processes we are using in Kolebu Teaching Hospital must be the same process used in Tamale Teaching Hospital. I'm mentioning teaching hospital so that we look at, we don't compare apples with oranges. Whatever pertains in a district hospital must be compared with the district hospitals. So these processes must be made clear, coherent, and seamless implementation so that if you are bringing in a patient from Tamale to Kolebu, it is seamless. You have all the data information in a similar similar manner, and the people involved. Do we have the right people doing the right work in Kolebu? For instance, if you say somebody is an IT officer who understands what the who has the temperament, the integrity, and then the skills involved in doing his work. It's the same as, we can compare human, but their character, their skill set can be compared with whatever skill set you have here. Ensure that a similar skill set is given to people elsewhere. That is what IT governance dictates. That is what enterprise architecture dictates. So that implementation will be very smooth across. You look at the technology. Are the technology we have in place talking to one another? Are they delivering? Are they delivering as expected? if the technology cannot speak to one another, then there's also an issue there. So that must be addressed. So these are some of the considerations NITA comes in to ensure that the right thing is done by the right people, right process, and right technology at the right time. And we have a number of efforts that we are doing presently to achieve that. With the people involved, the consideration is that the Act guides us to put policies, put requirements down to address issues of the skill set needed for people undertaking those work activities. We have Mr. Kwashe mention of ITIM, the scheme of service for IT officers. This also will address issues of progression, issues of separation of duties. And this is very important, separation of duties. You cannot practice as an IT officer, you cannot use your IT background to call yourself a doctor. This is highly not possible. You'll be a charlatan and you'll be fished out the very first day you pose as a doctor. Why can't we do that in the IT sector, in the IT field? Sadly, you will see somewhere an admin officer performing the role of IT, or even a doctor heading the IT unit, which the IT person cannot do anything except either to conform with their structure or you leave the scene. NITA is coming in to address this issue, and we have documents to back this, to back us up. The enterprise architecture is very clear on this, and that is what we are going to do to safeguard the IT people in the sector, not only in the health sector, but nationwide. The IT class must be made as special because digitalization without them, nothing will work. And we must recognize that. There are actions that we are taking, and you will see coming days what NITA is going to do in that regard. We have the IT standards that also guides us to ensure that IT officers perform their duty to achieve results, and the protection of IT officers will also be secured how IT is implemented. Without following these protocols, we will not achieve our digitalization goal. So it's very important that we follow governance. Even following governance alone, whatever initiative that we are doing, e-health, all rests in following these basic frameworks. Other than that, there will always be challenge because IT is unique and is special. And it is a global and best practice to do that. Whilst looking at this, there's always the legal, the punitive aspect of it. Let's be mindful of that. Or the act clearly spells out what we can do and what we cannot do, which the IT fraternity should be mindful of. There has been issues where IT officers have been involved and are taken to the to the slaughter, if I may say so, whilst in actual fact it is not a fault of theirs. And let's be mindful. Some too we condone and connive to undertake certain activities which the law forbids. So let's be mindful of that and then get enough knowledge about how to implement whatever initiative that our institutions are running. You look at registration of, as mentioned earlier, registration of professionals to ensure that the right people do the right, and then support that NITA is to give to IT professionals. This platform will ensure that NITA does that and does it well. We are going to register IT companies as well, because most often they are the companies that undertake IT or digitalization work for the sectors or for the agencies. And if a company does not know does not have the requisite skill or experience to do this, we will identify them and we will not allow them to perform those roles. And the people within those companies too, if they are not registered, for us to know the various level of skill set that they have, we are not going to allow them to perform deliver any services for any MDAs. So these are some of the things that we are going to do, ensure that the people aspect of delivering results is achieved. As we saw earlier on in Mr. Kwasi's presentation, and what I mentioned earlier on, registering people will be based on their academic qualification and their experience, since the requirement needed to undertake any IT or ICT work is largely based on this requirement, and that is what we are going to observe going forward. Yes, the process aspect of our digitalization implementation, as indicated by our enterprise architecture and our governance of IT standards, ensure that compliance of the standards are achieved. The standards spells out how we implement these projects in the digitalization. Addressing interoperability issues also has a process to fulfill. And the documents clearly indicate that yes, to undertake any activity, exercise, you need to follow the process that is needed to achieve your result. So when we come to do our studies or audit, some of these things are where we will probe to ensure that we let you align your strategy with your with your capability, IT capability that you have. Other than that, you have problems of interoperability, and you have problems of even implementing your strategy. IT audit will also periodically be done to ensure that yes, IT is delivering results. Some of the standards that NITA has developed over the periods are data center standards. Data center standards, as it is, provides the requirement to ensure that we have enough robust infrastructure to support data and flow, how government handles, and efficient enough, the center is efficient enough to ensure continuous service delivery or service availability. So that also spells out what to do and what not to do to achieve service availability, which we urge all IT officers to go through it and have it as tools in their day-to-day activities. The IT management of IT infrastructure is also a standard document that have 5 sections that deal with operations of IT equipment, management and usage of IT infrastructure. Look at IT equipment and software management guidelines, and maintenance and repair of IT equipment, the human resource capacity development. So basically, we have a regime of how maintenance of equipment are done. How long will you repair the equipment? How often you need to repair the equipment? How do we manage softwares? All these things are in the document for you to understand, because if you don't follow these guidelines, you tend to create problems, and the problems will have impact on how you use IT to deliver. The use of these guidelines to ensure that the use of IT infrastructure across government in delivery of IT services is done to ensure consistency that will increase your confidence in using ICT to achieve results. We have LAN 1. LAN 1 standard is also an important standard that needs to be looked at. It provides guidance to the process of implementing structural cabling to enhance the delivery of voice data and video. And this will take into account how do we secure a transport layer of your digital experience. You look at security consideration when you are laying the cabling. You look at service experience, connectivity experience. if you don't use the proper way of laying your cables, you tend to have challenges in connectivity. There were occasions when those days were providing services. Occasions MDAs will call and say you have poor services, poor services. You go and do a survey and you realize that their land configuration is totally wrong. And even how the cables are laid is also wrong. That is having an impact in achieving service connectivity. So these are some of the things that IT officers within the MDAs as well as the health sector should take note of. Having the guide to help you address issues of LAN 1 is key to your success in delivering health digitalization. We have also disaster recovery standards. All these standards are done based on best practice and international standards. Indeed, the Act 772 also talk about records. The need to do backup. They need to have logs. So all the standards will guide you as to how to ensure that you have continuous service delivery. If there is any breaches, you still have your data or you have your system operating at a short in a short time. So IT officers, you understand the principles of backup and disaster recovery. This document guides you appropriately how to manage that issues arising out of disaster or backup. IT governance standards has also been developed. And as I said earlier, IT governance seems to be the bedrock of IT implementation. This document recognizes the critical role of the IT functions, the critical role IT play in an organization and need to be placed at par with the core activities of the institution. And this is an issue that NITA wants to see that all MDAs as well as the health sector will observe it, and it is it's always an audit issue. Who does what and how can be addressed within this document. This document talks against discretionary use of power. This document will tell you exactly who should perform what and how. To do this, you need to implement a successful IT initiative. If the governance aspect is not clearly stated, you have problems of implementation. And the problems that you face will even go out and hit the usage of the system. To avoid it, please let's follow the governance, and the document clearly says so. The technology aspect, as we mentioned, NITA is creating an opportunity to have to do away with silos, where we have shared services, facilities, or infrastructure. Data center will serve a repository of data for all institutions. Where are we hosting our data? Do we have the facility to contain our hosting of our data, or providing us an opportunity to have an infrastructure that will provide us continuous service? We have a directive here where hosting your data outside your jurisdiction, I mean outside your country, has a regulatory implication. To avoid it, we have a data center, a national data center that will serve the purpose. So NITA is drawing attention to this fact that the data center must be utilized by all the sectors of the economy, of government, and we provide hosting services as well. We are mindful of security of our systems, and we have provided avenue for privacy, confidentiality, and integrity of data. We have a SOC. We have a SOC that works 24/7. SOC, the Security Operations System Center, which is also a first-class facility. Some of you who want to see some of this and some of these facilities, to assure you that yes, we have facilities that can ensure or enhance confidence in our facility. Please just express your interest, and we will take you through and show you all these facilities. We have a Tier 3 facility hoping to secure a Tier 4 certification. This facility also implements systems for backup and business continuity, and it is for the sectors of government to use it. You are not allowed to store your data outside Ghana. That one regulation frowns against that. So we also ensure procurement of genuine equipment and devices, as well as licensed softwares. We have a shared services infrastructure platform, which we term as the smart workplace. And indeed, it has helped us a lot during this COVID era. And we urge all sectors to to come on board and then get the best that they can in implementing their digitalization efforts. This technology domain of the enterprise architecture or the digitalization effort is key. This is to provide, what our focus is to provide an infrastructure or system that will promote interaction in a secured manner, where issues of authenticity, integrity, and confidentiality are bedrock of our implementation. For instance, especially the health sector, electronic document management system must be very secure. And NITA ensures that whatever system you are operating has that characteristics. Secure web access, including wireless access, doctor-patient portals. There's this strong element of security that is required, and NITA standards and processes will give you the security that you need. The enterprise architecture and interoperability framework, if implemented, will give you these characteristics that I'm mentioning: authenticity, integrity, confidentiality, non-repudiation of your online interactions. So let's be mindful of this aspect. Medical diagnosis systems. These are key systems that is commonly used in the health sector, and consideration must be given to the security of these systems by following best practice, enterprise architecture, interoperability framework, and all other documents, especially governance. So it is the governance aspect that will ensure that we have integrity, people of integrity, especially the security aspect talks about integrity. Integrity is seen in the three domains that are mentioned: the people, the process, and then the technology. We must have these things in order that we deliver what is required of us. The referral trackings, computerized provider order entry, and online support groups. Virtual reality is coming to us. Patient portals, remote patient monitoring system, electronic signature. These are tools that requires that we use to achieve our purpose, but must be used having security, authenticity, integrity, non-repudiation values in mind. Now let's look at the legal guidance that we need to observe As mentioned earlier, we must be very, very careful, especially IT officers. I'm not saying other non-IT officers must not observe it. No, but then our knowledge of the legal environment with which we are operating in is key to protect us or to guide us. Protected computers and critical database, the right of inspection. The minister can cause an audit, and then the act spells out the requirement, the guidelines to follow. And that is what section 55, 61, 62 is talking about. You can't just do anything at all and go scot-free. Whatever we do, whatever infraction we cause today, and we leave the scene, or we are transferred, or we retire, we can still be found culpable if an audit is conducted. So if what we do, even though we may rub shoulders with our superiors here and there as to how things are implemented, but it's good to express yourself based on the law than to keep quiet and do it and find yourself. So let's look at this very carefully, and it shall help us to implement our digitalization successfully. There are occasions that our supervisors or superiors will not be mindful of the provisions of the act or the law. But if we know, then we draw their attention. They will understand our reluctance to undertake those activities that they want us to take. So let's gather courage and then let them know. I mentioned earlier on the backup and disaster recovery policy. The Act 103 enjoins us to provide that the provider to keep logs and records is for a purpose, and that act has given guidelines as to how and why this should be done. It's refreshing to know that our backup policy standard documents will address all issues that section 103 is looking for. So let's take time and go through it. And some of these things are addressed in the standard documents or the documents that NITA has provided. They are very key to helping us do our work successfully without being found erring. The Act also specifies a number of offenses using IT electronic platform to steal. There is a consequence that goes with this. You'll be jailed, you'll be fined. Let's be mindful of this as well. Appropriation. All these offenses are based on using electronic platform to undertake these crimes, offenses. You may not understand that the activities you are doing is offensive. Until you read, then you know that yes, indeed, it is an offense to do that activity, but by which time you have incriminated yourself. So let's take note of this and ensure that we do the right thing. 134. There's an issue there that maybe we'll come to know it later. So these are the list of offenses. Please look at it and let's see the guidance, the guidelines and requirements are there, what to do and not to do in order that you commit these offenses. Negligence, criminal negligence, access to protected computer, obtaining electronic payment medium falsely, electronic trafficking, possession of electronic counterfeit making equipment, general offense for fraudulent electronic fund transfer, general provision for cyber offenses, unauthorized access or interception, unauthorized interference with electronic records, unauthorized access to devices, unauthorized circumvention, denial of service, unlawful access to stored communications, unauthorized access to computer programs or electronic records, unauthorized modification of computer programs, unauthorized disclosure, offense relating to national interest, causing computer to cease to function, the illegal device, child pornography, confiscation of assets, order for compensation. All these are offenses that we need to be mindful of. There's this thing that caught my eye, causing computer to cease to function and illegal devices. For instance, the act is a person who intentionally engages in conduct, including virus writing, writing a script, virus and worm dissemination, which cause a computer to cease to function permanently or temporarily, commits an offense and is liable to summary conviction to a fine of not more than 5,000 penalty units or imprisonment for a term of not more than 10 or both, 10 years or both. So you see, causing computer to cease functioning. Here, the mention of cyber activity, writing script, and all those things. There is also another one, 135. A person, an illegal device, a person who intentionally, recklessly, without lawful excuse or justification, possesses, produces, sells, procures for use, import, export, distributes, or otherwise makes available device, including a computer program that is designed or adopted for the purpose of committing an offense, or a computer password, access code, or similar electronic records, but which the whole or any part of the computer is capable of being accessed. So now, you can see this, an IT officer, knowingly or unknowingly, discloses password or password is given to a third party. whether by a superior insistence that an IT officer should hand over some of his role to a different third party to help them achieve their this if there's an issue later on. You, the IT officer, will be found wanting if you don't do the right thing, you don't document whatever recommendation you gave in that instance. When it comes to offenses, you have committed an offense. So make sure in such circumstances, draw the superior attention of some of these provisions before you hand over any device to somebody you don't know, somebody who's not supposed to manage or handle the organization's IT resource. So these are some of the issues that we should be mindful of. As I mentioned earlier, how IT played during COVID era. It is because the pandemic highlighted the power of IT in the digitalization ecosystem. We are also aware that digital health transformation is taking place at an accelerated pace for effective delivery of care with standardized information sharing. Here, the use of EA interoperability defines the standards to follow. If you don't use standardized way of doing things, information sharing will not be achieved. And digital health transformation must take note of this aspect of sharing. The need to address technology-related patient safety issues and the privacy of health data makes it imperative for NITA to monitor and enforce the provisions of the regulation. If this is not done, there is a problem. A device can kill, as said earlier, and an IT officer can kill, or a daughter can kill through the device they are using. So the right standards must always be used to ensure that the technology perform is optimum level. Interoperability of systems is critical in ensuring continuum of care among healthcare providers that has been established. Without having interoperability in mind in our digital transformation, health digital transformation, then we should forget what we are doing. Self-managing e-health systems with the requisite skill set and provide with fit for purpose logistics. This is what staff must be given to ensure that, yes, whatever the staff needs in order to deliver must be given, especially the skill needed to deliver service, to deliver is responsibility is key. So there must be continuous training for IT officers, since IT is not static. It changes every now and then. So we must be abreast with that in mind. As technology transforms, we also move with technology. Healthcare institutions must institutionalize IT governance. This is key. IT governance symbolizes the three areas of digitalization: the people, the processes, and the technology. If we don't do this, still we will not be able to undertake digitalization successfully. And there's the last issue that I would like to underscore is disregard for best practices and breaches of legal and regulatory framework attract sanctions and fines. And this is a way of ensuring conformance and compliance. And this is where NITA comes in. If we say persuasion fails, we will now enforce our compliance regime, and that's where sanctions and fines comes in. Thank you for listening to me. Over to you, Rahman.
Thank you very much, Mr. Your presentation. So we have, I think, 2 questions from participants directed towards Mr. Kwashi's presentation. And we will take other questions too. So in case any of you have questions, please kindly raise your hand. And yes, so Kennedy AJB, I see your hand up, so you can unmute yourself and ask your question.
All right. Mine is not a question, but I just want to make a suggestion to
please go ahead.
Issa. Yes. Yes, this is a fine and nice presentation. But yes, as far as we are concerned, we are very privileged and lucky to get this attention. But I will also suggest that they also target, for instance, in the health sector, they target the directors, the senior managers, and then give them this piece of information so that at least when we are talking on the ground, they will also understand why we are also talking like that. That is my suggestion. Thank you.
Thank you very much, Mr. Kennedy, for your suggestion. Any other suggestions or questions or additions? Kindly raise your hand and we'll give you the platform to do that. In the meantime, Madam Teresa, your question is still incarcerated. We'll release it very soon. I haven't forgotten. So any more questions, please? Questions and suggestions are welcome. Okay, Mr. Musa, please, I would kindly ask that you, okay, so we had another hand up. Mr. Wanda, kindly unmute yourself and ask your question or suggestion, please.
Thank you very much for the opportunity.
You're welcome.
Please, when Mr. Kwati was giving the presentation, I went to the NITA website to look for the document on the cybersecurity in specific, but under the tag for Enabling Act and Policy, I only saw the Data Protection Act document, but the particular one for cybersecurity, I am not able to see it. And that is the question to Mr. Kwashi. I can't find the document about cybersecurity in there. Now, the second part is to Mr. Musa. That one, does it mean, so with all the acts and the laws that is supposed to guide we, the IT personnel, does it mean if somebody in the organization comes with a gadget claiming he or she has misplaced his password or something like that, we should bring a document for the person should sign that will prevent us from whatever way we shall pass for maybe the desktop is being locked by password and we have to use some tools to bypass those, which by now the law is saying if we do those things, they are offenses. So do we have to write some sort of contractual document for these people to sign before we go ahead to work on their machines? That's what I wanted to ask. Thank you.
Okay, thank you very much, Wanda. So I think Mr. Kwashi would answer the first one, then Mr. Musa Isa will proceed answering your second question. So Mr. Kwashi, please.
Okay, all right. So thank you, Wanda. The cybersecurity documentation can all be found under the Cybersecurity Authority. I'm posting the URL is www.csa.gov.gh, and then you would go to resources, and then you find they have copies of the Cybersecurity Act over there. They have the cybersecurity, the Critical Information Infrastructure Directive. You can also get the Data Protection Act, the Electronic Transaction Act, the Electronic Communications Act over there at their website. So I've posted the link on the chat session. So if all of you click on it and go there, you would get the copy. So I guess you were talking about session 132 on the with regards to the disclosure of passwords and the access code and the rest. Okay, so this access code. Okay, so let me look at it. Let me approach it from a cybersecurity perspective. Okay, so when you are a systems administrator, you are in charge of the entire IT infrastructure. Okay, so let's say you are the systems administrator of a hospital and you are in charge of a hospital information management system that contains the database of maybe 2,000 or 3,000 patients' medical records. In addition to that, your hospital is a smart hospital, and the software that you use for the integrated or intelligent building management systems that allows the IT person to troubleshoot and also shut down all the hospital's electrical installations, the AC, the lighting system, the biomedical diagnosis equipment. Okay, you have the password, you have the access codes. What the act is saying that if you, without authorization, hand over this access code to a third party, chances are that you'll be prosecuted and the jail term is 20 years. The reason why it is that it is this way is digitalization is very key in securing individuals' privacy, confidentiality, and in the integrity of data. The Act, if it is followed to its fullest, requires that before an IT person is employed and assigned a very sensitive position, must undergo security checks and background checks, criminal checks, and also sign a contract with the institution saying that because of the responsibility that you have been assigned to, you have been assigned and entrusted with the whole infrastructure of the institution, you would not engage in any inappropriate or unethical practice. Handing over passwords or security code is like a bank manager of a major bank handing over the keys to the safe or access codes to the safe to a third party. And when you do that, you'll be heavily punished. This is one segment. The other segment we are talking about is if an individual brings his laptop to you and there's a password. The truth of the matter is if you are an IT manager and you are implementing systems based on best practices, you should know that at any point in time, there is one systems administrator. So end users' laptops, when configured, must be configured first with an administrator password, and second with the user account's privileges. And then you assign privileges to the end user. So at any point in time, the administrator has an overall control full over the network infrastructure or an individual's laptop or other computing devices if you do the right thing. So to serve as a deterrent and to discourage IT managers from engaging in inappropriate or dysfunctional corporate behavior, this law, the provision was put in the law so that the IT managers or people managing infrastructures will know the seriousness of engaging in said practices. The IT manager or IT professional position is a very powerful position. It's not being realized, especially in most public sector institutions. But in institutions like banks and other high-level corporate institutions, you are very careful how you manage and treat IT manager because he can bring the whole organization's infrastructure to a standstill. Okay, so approach it from the angle at which I'm talking to you about. It's difficult to explain it when you are following an ethical practice, when the person has brought his laptop to you to work on, and that user is also an administrator. Then if you want to do anything about his password, or you require his password to reconfigure or upgrade or do some hardware device installation, obviously you need he or her administrative password. And to play it safe, you must let them know that the administrative password that is being provided to you, you are not keeping it in your mind, into memory, you are not documenting it, you are not writing it anywhere. What I do in the course of my job is, if I have to configure somebody's laptop and I realize that the laptop has an administrative privileges or administrative login credential, I let the person log in his password himself. I don't want to know. So that tomorrow, if anything goes wrong, you don't come and say that they gave you the administrative password and you pass behind and use the administrative password to engage in some unauthorized and unethical behavior. So I would advise that as professionals, we should be mindful of everything that we are doing. And one of the things that we should look out for is what is the best practice, what is the standard regarding or impacting on the situation that I find myself in and apply it accordingly. I share an experience with you. There's an IT manager whose medical director asked him to hand over the passwords of a hospital to a third party. So he being mindful of what the implications are, asked the medical director to put it in writing. Initially, the medical director did not do it. He also refused to hand over the passwords without an official request to the third party. Okay, it became back and forth. He was queried, and the IT manager responded to the query, quoting this, I think section 132 or so of the Electronic Transaction Act. And the medical director withdrew and said he didn't even want that documentation to be on record. So it's like nothing had happened. So they never handed over the password to the third party. So like Mr. Musa said, yes, you might at all times find yourself having to confront or engage management, but make sure that in your contribution or your comment or in your write-outs, you write-ups, you quote the law to support your case. So this is what I have to say. Everybody, as IT professionals, we are high risk. I don't think there's any profession that has to contend with all these legal regulatory frameworks. It's only IT. You must be careful and know the Data Protection Act. You must know the Electronic Transaction Act. You must understand the provision of the Cyber Security Act. You must understand what the operating conditions are under the National Communications Authority. You must know all that. I never knew the important role of National Communications Authority till a vendor got a contract to supply some routers for one of our teleradiology projects. And the routers were impounded at the airport, not by customs. The National Communication Authority refused to hand over the router because of security issues. So we had to go and pick up a form. I had to go there, pick up a form, sign, provide details to the effect that I will follow best practices and protocols and other IT standards when using the system. And because I also wasn't too sure this aspect of whether it would be used for the intended purposes, I let the program manager sign the document. Because once it's not coming to me, it's going to a third party. I'm not too sure what the third party would use those high-end routers for. So knowing the law would also help you get out of trouble and also be very assertive in defending your situation. Yes, it could be intimidating. Management will threaten you, but when you stand your grounds and stand your grounds by sticking to the provisions of the various legal and regulatory frameworks, you'll stay out of trouble. This webinar is for awareness creation and also to help you people address issues in a professional manner when they arise. If you are confronted with any situation where you can't fight it out alone, I think you would have to get Mr. Musa email details and reach out to him and ask the regulator, they can intervene and put things in order. I'm done, thank you.
Thank you very much, Mr. Kwashi. Mr. Musa, would you want to answer the second question?
I think Mr. Sam has answered the second question altogether. So thank you.
Okay. All right. So, Mr. Musa, please, I would kindly ask that you stop sharing so I can share some questions asked in the comment section. In the meantime, I have a hand up, Mr. Amo, who is a guest. Please unmute yourself and ask your question.
Yes, thank you so much. My name is Michael Amu. It's really not a question, but it's just an addition to what Mr. Kwashi just addressed to my other colleague who asked about passwords. So the little thing that I want to add to it is, you see, when you are, let's say, a system administrator, there might be, you might also have a colleague who also has a higher privilege of accessing, information in the system. So if there's a problem with that person's password or login information, and he approaches you, one thing that you must always have in mind is need to know basis. Does my colleague, who is also a system administrator, have the necessary security clearance to access the information that he wants me to help him access? If he does not, then you should try as much as possible not to use your credentials, no matter how threatening it will be, because the consequences are very, very daring. So the need to know basis should always be, at the back of our mind anytime that we are trying to, give someone access to a whole, especially a hospital's, server or system, because now the cybersecurity issue is really, really getting very rough. You might not know until it happens to you, when there's a ransom attack, and you don't know who they are targeting. These guys are very, very dangerous. So the need to know basis is really, really important. Okay, thank you so much.
Okay, thank you very much. Okay, so we have a question from Madam Teresa to Mr. Kwashi. Says, thank you for the presentations. Please, how are our IT professionals positioning themselves for all that is ahead of us in the IT space? That is structured training, academia and industry, the role of NITA/IT professional groups. Thank you. And this question is directed to Mr. Sam Kwashi.
Okay, all right. So thank you very much. The IT profession is very dynamic. Okay, and when I say it's very dynamic, what I mean is that we are in our profession, we are faced with rapid technological advancements. Okay, so one moment you can be certified in Windows 2007. Another moment, your credentials or expertise, you find that they are no longer required, because the vendors have come out with a new platform, let's say Windows 10, and you do not have those competences and expertise to effectively and efficiently manage issues relating to Windows 10. Okay, so in an industry that prides itself in certifications, learning is continuous. You don't have a choice. Once you're IT, you don't have a choice. You have to be continuously reading and learning. There are two things I encourage IT professionals to do. Take advantage of training, be abreast with latest developments on matters relating to your ecosystem. The regulator, which is NITA, has put in measures that permits or allows IT professionals in the entire country to undergo training. If you are aware, recently, and the NITA, the National IT Agency, collaborated with LinkedIn, and there was a free training platforms. I don't know how many of you participated or undertook took that free training. It was for a 3-month period from the 1st September to the 31st December. I personally participated in all the training. I have the certificate because if I have to do it, it will cost me some thousands of dollars. And a lot of the subject areas I didn't know. Now I know. I used to think that digital marketing was only Facebook and a website. But after I undertook the digital marketing course, I was shocked. I didn't know nothing. I mean, you can easily be very ignorant. You don't know anything. And I become very informed. And that also helped me because then when those digital marketers are speaking, I understand the issues better. In the marketing space, when they talk about acquisition, digital marketing space, when they talk about acquisition, I know what it means in the digital marketing space. Otherwise, in English terms, when they say acquisition, you want to go and buy something in the market, it's totally different. So the IT professional should avail themselves of opportunities for training. In addition to that, there are several online training tutorials available. YouTube, have several training on YouTube. And then also, if you go to vendors of systems, if you go to the Cisco website, they have training. If you go to Microsoft online website, you can get free training. So don't wait for a full in-person webinar training to be organized or arranged for by your wherever you find yourself. Identify which space you want to operate. Identify an area of specialty. If you want to do cybersecurity or programming or database administration, focus on those areas. Identify institutions or associations that offer those services. Sign up to them. Get newsletters. Be hungry for knowledge. And I tell you, you have more than enough to, read. Okay. You must also watch the space, the digital workspace. If you watch now, the digital workspace has shifted to cloud-based systems and cybersecurity. The COVID-19 shifted it. The COVID-19 introduced a new dimension to our IT workspace, which is telecommuting, cloud, working from the house, putting your data in the clouds, making sure everybody can access it irrespective of where they are. But also another dimension, which is cybersecurity. So how are you sure that the person accessing the corporate data using a remote networking platform, either a virtual private network or whatever channel they are using, is the person supposed to do? And also is accessing resources that he is authorized to do. I'm very happy when Mr. Amo spoke about the privileged access. Okay, so you realize the ecosystem has changed. So if currently you are an expert in I don't know which of the functions, but you're an expert in that area, you might find out that you'll not be really needed in that space because the industry is moving towards another angle. So to be relevant, you need to reposition your competences and your skill sets, and also be mindful of what changes are happening in your space. So that is there. These webinars are also part of the cybersecurity or capacity building or training. Fortunately for us, the Director General of the National IT Agency has been very instrumental in the support for these webinars, and we already have a jam-packed activity for this year. So every every fortnight, that is every 2 weeks, there's going to be a webinar. The next one, which we'll post after this one, is hacking of healthcare institutions. So I've managed to speak to an expert hacker who is ready to share practices of hacking and what you need to do to protect yourself, the tools that hackers use to hack people, network, infrastructure. There's going to be a live hacking session. So happens phishing and the digital footprinting and the social engineering that you read in cybersecurity books would all be demonstrated in live session. And thereafter, then you will know, okay, on what to do to in the cybersecurity workspace. I'm trying to see if I can get the Director General of the National Cybersecurity Authority to speak in detail on the Cybersecurity Act and what is required of the status of the critical information infrastructure. I am told, even though it's not been documented, that from the national cybersecurity perspective, every healthcare institution that is embarking or have embarked on digitalization and is designated as a critical information infrastructure must automatically have an IT security department. Okay, so which means that if you're IT and are very good in systems administration or only database or programming or hardware, there's an opportunity to also add another competencies or skill set to your skills level. So we have to move on and be hungry for knowledge. IT is a very paying job. It's very lucrative. If you are very, very good and you know what to do, you might not be working for only your organization. You might be getting some private consultancies somewhere to do. If you can give proper advice and articulate the issues properly, you make some money off it. So this is for my for the first question. Now for the second question, it says there has been a growing adoption of electronic medical records by various hospitals. Yes, okay. So the National IT Agency, NITA, is the regulator. So NITA will very soon be enforcing compliance with the provisions of the enterprise architecture. There are two levels of the enterprise architecture. There's the National Enterprise Architecture, which is the Government of Ghana Enterprise Architecture. It is called GGEA. And then there's the sector-specific enterprise architecture. So whichever approach you look at it, irrespective of who you are, whether you're a vendor or you're an IT practitioner or you're an IT professional, there is the need to comply with these standards from the national or at the national level before you also adhere to the requirements at the sectoral level. So the National IT Agency, NITA, in collaboration with the Ministry of Health or stakeholders of the health sector would undertake. They have actually written to the Ghana Health Service to start the assessment. So the National IT Agency is working with the Office of the Director General to address all these compliance with standards and regulatory issues. In addition to that, I want to state emphatically that the National IT Agency is also working with development partners like the World Bank in securing loans to build a health information exchange. They have obtained funds from the World Bank. A health information exchange is going to be designed and developed for the health sector. It's going to go through some processes. The terms of reference for the activity has been designed and developed. It has to be forwarded to the World Bank for the World Bank to review it. Then it will go out for tender. I'm going to get a software vendor or a consultant to review our ecosystem and develop and define standards that every vendor, hospital information management system or EMR vendor would be required to comply with, because if you do not comply with it, it's going to be difficult when it comes to seamless integration and sharing of patient data amongst the hospitals. So this is my response to Teresa's question.
Okay, Mr. Kwashi, thank you very much for that insight. And we have one in the comment section. I think this will be the very last one from Bright Adam. He's asking, any information on an IT professional body like GMA?
Okay, so I think if any of the executives are online, they can respond to it. The IT professional body set up an executive. The executive was supposed to work towards the formation of an IT professional body for like the GMA. And if they're online, they can update on the status of the activity. I don't have any current information on it. What I know is they are working on it. Should have gone to the Registered General Department and registered a name and company and logo and all those stuff. So this question can also be posted on the IT managers platform. So if they are not here, they can respond to it.
Okay, thank you very much, Mr. Bright Adam. That was for you. Okay, so we'll have the very last one, Mr. Wanda Comlight. I see your hand up. Kindly unmute yourself and ask.
Thank you very much again for this opportunity. Please, for some time, currently I'm a student and I'll be completing this year. For some time now, I've been participating in this webinar, and I wanted to ask if there is a way we can have a form of certificate of participation that we can put on our CV as students, so that when we are out there searching for work, participating in this webinar would tell our employers that we have had some information or knowledge about this IT security system and the various aspects to it. Thank you.
Okay, so we work on the webinar. I think this is about the third or fourth time somebody is asking questions on getting some recognition or some certification for. So we will work on it, and the team would work on it, and then we'll keep you updated. We will go back and then generate digital certificates for people who would attend. But also you have to make sure you attend in full, so you don't log in and sign up and you are on for 10 minutes, and then later on we give you a certificate for that you have fully participated in it. So that will be the only condition, but we'll work that one out for you. Thank you.
Thank you very much, Mr. Kwashi.
My boss, Jerome's hand. Thank you, sir. My boss, Jerome's hand is up.
Okay. Thank you very much, sir, for the presentation. I really want to put this question across to the Director General for data. I so much appreciate the information they put across in terms of registering IT professionals in the country, or making sure that we come under one umbrella so that our work should be regulated. But I also humbly want to ask if it is possible for the agency to also look at not only regularizing the work that we do, but also considering what goes into our work. For instance, if you are asking that somebody is certified to become a system administrator or a network administrator, it goes beyond just a classroom academic qualification. It means that you have to go and take a step ahead by certifying yourself. And we know that these certifications are not cheap. They are very expensive. So if I happen to get 2 or 3 certifications before I'm given this task to perform, what are the things that NITA is putting in place also that our
our employers would make plans for, so that you don't spend so much to equip yourself, but the rewards coming to you are not commensurating. Thank you.
Thank you very much. I believe that's directed towards Mr. Musa Isa, so I think he will address that. Thank you.
Yes. Yes, the rationale behind trying to bring together IT professionals is to have, may I say, a bargaining power to ensure that the welfare of IT professionals is catered for, and also the requirements that is expected of an IT professional is also addressed. We had IT scheme of service. What we had, there was that remuneration aspect was not conclusive. So NITA coming in to take up this headship issue will ensure that yes, this is addressed. And indeed, we know what is happening in the private sector. The government sector, you train an IT person to acquire relevant skill set, and because of poor remuneration or even conditions of service, mostly they leave. Not even the working environment is not made conducive for a professional IT person to professionally do his work. So all these things are issues that NITA is taking up, and as when we are discussing these issues, because the documents have been written a long time ago. So what we are doing is to put some sort of regulatory aspect to it, so that when we are implementing it, we are implementing it with power and with all the forces that we can marshal. That is what is happening now, and it's indeed true. If your environment is not so conducive for you to acquire certain skills that demands a lot from you, resources, time, and at the end of the day, you are not able to use it. You are not able to make any meaningful resource out of it. It's as useless as even starting it. Yes, it's true. NITA is looking at all these things to ensure that the IT profession is also accorded the maximum regard or respect as other professions, because without you, no digitalization can go on. It's just like with our doctors, hospitals,